Ay. Hello po, Doc.
Ay, positive po, Doc. Sige, tawag ko ni Dr. John, Doc. Opo, sabi ko lang.
We'll wait for the others.
Doc, positive siya, Doc, si Juan Sebenito.
Hello. We'll wait for the others. Okay. So I'll give you 5 minutes.
Hello? Oo. Si Ma'am, Ma'am Divine, positive isuna ni Sebenito. Positive po. Okay. Tawag ko ni Dr. Sige na tayo. Negative. Chief expert. Pero negative. Ay, positive. Positive. COVID. Positive COVID. Okay? Okay.
So we're still waiting for others. Okay, can we begin? Can you see the slides? Slides? Hello? Can you see the slides?
No,
Wala
Doc.
pa po, Doc.
Okay, okay.
Yes.
Wala pa?
No, Doc.
Can you see the PowerPoint already? Okay na?
No, Doc.
Okay. So before we start, so let us pray. So in the name of the Father, and of the Son, and of the Holy Spirit, amen. Lord, we offer you our class today. We pray that through your divine guidance, sandali lang. Wait po. So, okay, so Lord, we offer you our class today. We pray that through your divine guidance, we would learn how to listen attentively, okay, to the inputs of our teacher. May we appreciate his effort in imparting his knowledge to us. May we participate actively in the discussion and activities so we could learn more while having fun. May we value each other's contribution as a building block towards harmony and peace. Grant that we interact with one another, we recognize the fact that all our learning activities should be accomplished for your greater glory. This we ask of you in Jesus' name. Amen. The Father, Son, and Holy Spirit. So good morning. So our topic today is coronavirus. Okay, so this is timely, okay, because of your COVID-19. Okay, so we will more concentrate on the COVID-19, your SARS-CoV-2. Okay, so konti lang yung common colds caused by your coronaviruses, but we will concentrate more on your COVID-19. Okay, coronaviruses are large envelope RNA, so they are envelope. Okay.
Doc, wala pa po yung,
Come.
yung PowerPoint po. Doc. Hindi po namin nakikita.
Wala. Okay, you cannot see the PowerPoint. Okay, so I will share. You share. Can you see now? Can you see now?
Yes, Doc. Yes, Doc.
Okay. Okay. So we have a total of 73 students. Okay. So I hope still waiting for the others. Then they can come in now. Okay. And log in. Okay. So coronaviruses are large envelope RNA viruses. So they are envelope viruses. So the human coronaviruses, usually one of the most common causes of your common colds. But the most common cause of your common cold is your rhinovirus. Mainly can cause lower respiratory tract infection. Okay, so when you speak of lower respiratory tract infection, okay, it can lead to pneumonia, okay, and also implicated gastroenteritis, especially among infants. So during the early pandemic times, okay, when children are infected with your SARS-CoV-2, they usually present with diarrhea. Okay, but now, okay, even adults can also present with diarrhea for your COVID-19 rather than pneumonia. So a novel coronavirus was identified as the cause of worldwide outbreak of a severe acute respiratory syndrome way back in 2003. So that's your SARS-CoV. Okay, SARS-CoV started in 2003. Okay, so animal coronaviruses cause the disease of economic importance in domestic animals. Sorry po, may COVID patient kasi ako. Hello? Yes, ma'am. Positive kasi sa COVID si ma'am. Okay? So, i-decon natin yung isolation room. Decontaminate yung isolation room. Decontaminate din yung mechanical ventilator. Okay? Ay, okay lang ma'am. You were wearing naman the N95, the KN95, and the PPE. After the PPE, ma'am, di ba, nag-doffing naman tayo, ma'am, di ba? Nag-change tayo. Okay. Okay lang, ma'am. That's low risk, ma'am. Low risk po. Okay po. No worries. And, hello? No worries, ma'am. No worries. Okay. And beside, you have the fully vaccinated, ma'am. Okay. Thank you, ma'am. Thank you. Stay safe po. Okay. Okay, sorry po. So I have just patient who recently died of COVID-19 kanina. So coronaviruses. So this is a novel coronavirus. So animal coronaviruses causes disease, di ba? During the earlier times in Wuhan, this SARS-CoV-2 or the SARS-CoV way back in 2003 came from animal reservoir, and that was the bats. Okay, and by this time also came from pangolins. Okay, pangolin aside from bats. Okay, in Wuhan, China, and other wild animals na binebenta nila doon. So coronaviruses of lower animal establish persistent infection in their natural host. Okay. So this is the typical picture of your coronavirus. So I will let you see this picture. So this is the typical your coronavirus. So you are most familiar with the spike. Okay, this is the spike of the coronavirus. Yeah. So when we try to get it bigger, okay, the chain of your the alpha and the beta helix of your coronaviruses, this is the structure of the spike. So this is the receptor binding domain. So this receptor binding domain specifically binds to the ACE2 receptor. So this is the ACE2 receptor. So the ACE2 receptor is most commonly abundant in our respiratory epithelial cells. So they are abundant here in the respiratory epithelial cells, but your ACE2 receptors can also be found. Okay, this can also be found in the brain. That's why some may manifest stroke. They can be found ACE2 in the gastrointestinal tract, and they manifest with the GIT. So there are a lot of ACE2 receptors in our body. Okay, so this is the structure of the RNA. So this is the RNA. So it's linear. Okay, so it's helical. So this is non-segmented. Okay, non-segmented, single-stranded RNA. So this is the membrane glycoprotein. So this membrane glycoprotein serve as also a co-receptor. Okay, and most importantly, this is the spike protein, which is the culprit, okay, of getting inside our body because it's the one that binds to the ACE2 receptor. After binding to the ACE2 receptor, it is being endocytosed inside the cell, and inside the cell, it releases the RNA. Okay, the RNA, wherein the RNA undergoes transcription and later on translation into protein. Yeah. Okay, so next. So your properties of coronaviruses, okay, is 120 to 160 nanometer in diameter. So it's helical. Okay, so I've said helical. So it's a single-stranded, linear, okay, non-segmented, okay, positive sense RNA. Okay, so positive meaning it has to be converted into negative so that the negative can duplicate into more positive stranded RNA. So this is a 2 glycoprotein and 1 phosphoprotein. Some viruses contain the third glycoprotein. Okay, third glycoprotein. So again, this is an envelope coronavirus, widely spaced, club or petal shaped spikes. Okay, so the replication happens in the cytoplasm, and there are very two important structures in the cell that is also involved in making your coronavirus, and that is, or those are your endoplasmic reticulum and your Golgi apparatus. So there are three outstanding characteristics of your coronaviruses. One, it causes colds, your common colds, and your SARS, your syndrome of acute respiratory, okay, severe acute respiratory syndrome. It displays a high frequency of recombination. So we will discuss this later. That's why your SARS-CoV-2, when it replicates, okay, during times in a month, it undergoes your mutation or deletion. Sasagutin ko lang yung ng doctor sa COVID. Hello? Hello, Divine? Yes, Divine. Ah, 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 ah. Ni Vice Mayor? Oh, sa Gabriela, oo. Vice, ilan ang autosat niya? Ilan ang autosat? Okay, sige. Yung tocilizumab kasi diyan kay Sir, yung dalawa atang dose yan, 800 dose. Yung isang dose dyan, kay Dr. Singson, tanungin mo kung pwedeng hiramin. Kasi ipapalitan, yung isang dose dyan kay Sir Johnny po. Kay pakadam to ni Dr. Singson, nung mabalik na ako sa akin. Okay, no, ag tocilizumab ka, i-load mo ti 400, amo man yan. Okay, okay. Okay, okay, thank you. So we have a political personality. Nakawawa naman, may COVID siya. We have to give him tocilizumab. Okay. So kaya sila nag-imitate. There is deletion, okay, in SARS-CoV-2 during the replication. That is the characteristic of your RNA virus. During the replication, it undergoes deletion, mutation. That's why if many are infected with SARS-CoV-2, you are giving chance for the SARS-CoV-2 to undergo mutation. And if once they mutate, mag-iiba yung structure, they change the structure of the spike protein, then this can be may cause okay, mutation, and this can be of okay, variants of concern. So variants of concern meaning, okay, so all of us is concerned with this mutation because it can cause a lot of morbidity and a lot of mortalities. Okay, and they are difficult to culture. So the coronaviruses is one of the two families along with the Artiviridae with the order Nidovirales. Okay, they are classified. Coronaviridae include particle morphology. They have a unique RNA replication, unique. So even though they are non-segmented, they can still undergo mutation. They can still undergo deletion, and they can change the structure of the spike protein. When they change the structure of the spike protein, okay, the antibodies can no longer recognize it. Okay, so you have genome organizations. You have the Philippine Genomic Center. They study the sequence of these variants. For example, the variants coming from the UK, the B117, and the variants coming from the South Africa, the B1351, and the variants from Brazil, the P1, and the variants in the Philippines, the P3. So there are a lot of variants of concern na ngayon. And nucleotide sequence homology. So there are two subfamilies. We have the coronavirus and the Toroviridae. So the first two and the last genera contain viruses able to infect humans. So toroviruses are worldwide, widespread, and angulates appear to be associated with diarrhea. So it's nice to know. Okay, so this is a very important classification, taxonomy of your coronaviruses. So we have the order of Nidovirales. We have 4 families. So Arteviridae, Roniviridae, Mesoniviridae, and we are concerned with the family of Coronaviridae. So the family of Coronaviridae has 2 subfamilies. We have the Toroviridae, the subfamily Coronaviridae. Now, this is very important. The subfamily Coronaviridae has 4 genus. Okay, we have the alpha, the beta, the gamma, and the delta coronaviruses. But what we more concerned today is the beta coronaviruses. Your beta coronaviruses has 4 lineages, A, B, C, D. So we are concerned with the lineage B because it's the one causing your SARS-CoV-2. Okay, your SARS-CoV 2003 and your 2019. And the lineage C, okay, way back in 2012. Okay, the middle is respiratory syndrome. Okay, coronavirus. Okay, so this is the taxonomy. Now, how do they replicate? Okay, this is very important. So this is how they replicate. So this is the coronavirus. This is the respiratory epithelial cell. Okay, this is the host cell, and this is the plasma membrane. This is the ACE2 receptor, and these are the spike of your coronavirus. Okay, so the first stage in the replication of your coronavirus is that when we inhale, okay, through your droplet inhalation of your coronavirus, it gets into the nose. From the nose, it goes into the lower respiratory tract. So the spike, okay, binds to the ACE2 receptor. Okay, so it binds on the cell surface molecule. Okay, and another is the HE. This one, the HE. The HE, okay, binds, okay, to the N-acetylnuraminic acid. So this will serve as a co-receptor of your ACE2 receptor. But majority or predominantly, okay, the receptor is the ACE2. Okay, so the ACE also binds to the neuraminic acid. So once they bind, it undergo endocytosis. They will be engulfed by the host cell. Okay, so once they are engulfed by the host cell, this coronavirus enters into the cytoplasm. Yan. Once they are in the cytoplasm, okay, they will uncoat, maghuhubad siya. They will uncoat and it will release the RNA, this one, the RNA non-segmented linear single-stranded, okay, positive sense RNA. They will be released. Once they will be released, okay, you have the ribosome here. It undergo transcription by the enzyme virus polymerase. Okay, so this is the enzyme RNA polymerase. Okay, so this is the enzyme that is inhibited by your remdesivir. Okay, I think you have heard remdesivir, favipiravir, the medications. So this virus polymerase, okay, will transcribe this positive sense RNA into a negative stranded RNA. Yeah, negative strand RNA. So this negative stranded RNA will serve as a template, okay, to generate, okay, producing your positive subgenomic RNA. Yan. Magpuproduce sila ng subgenomic positive RNA. And this positive single-stranded RNA will be translated into protein. Yan. It will be translated into nucleocapsid. Yan. Transcription translated into nucleocapsid. So you have here the N, nucleocapsid will bind to the RNA. Yeah, magbabind yan sa RNA and making a nucleocapsid. Yan. So this is the nucleocapsid. So they will make now the nucleocapsid, the new nucleocapsid. Yan. Okay, replication. And the M protein binds to the plasma membrane. Okay, so if little by little they will form a virus. So there will be the formation or translation of this protein into a spike. So this will be translated into spike, okay, and they will be translated into HE. So they will assemble in the endoplasmic reticulum. So they will assemble in the endoplasmic reticulum to a new virus. That's why your ER is very important. Okay, so parang magbo-volte spike. Okay, bubuo ng new virus. They will form a new virus. And this new virus will exit and it will be engulfed by your Golgi apparatus. This one. Golgi apparatus. And after, okay, from the Golgi apparatus, they are ready now to be released as a new virus. So there will be a lot of virus that will be released, replicated inside the cell, a lot of virus, and this coronavirus will infect the neighboring cell. So they will destroy, okay, they will create destruction of the, okay, epithelial cell or the host cell. Okay, so remember, they do not bud. Okay, as the previous topic, last hour topic, the virus, they bud in the plasma membrane, but this coronavirus does not bud into the plasma membrane. It is directly released out from this host cell. Okay, so I'll give you a summary of this, a replication of your coronavirus. Okay, so this is the summary. So virus enter into the host cell via your aerosol transmission. So you are not observing minimum public health standard. You are 2 meters less or 1 meter less from an infected person. You do not maintain physical distancing. You held a contaminated object with SARS-CoV-2 like doorknob and you rub your nose or eyes. Okay, the virus enters into the face. You did not have or you did not perform hand washing. So it enters into the nose. And from the nose, it enters into the lower respiratory tract. From the lower respiratory tract, it sees the ACE2 receptor. So the S1 of the subunit, spike protein, binds to the ACE2 receptor. Once they bind to the ACE2 receptor, it will be engulfed, okay, endocytosis. So there will be conformational change of the spike, okay, changes in the viral spike protein. So they will penetrate, they will get inside the host cell, they will uncoat, okay. So after uncoating, okay, they will release the RNA, release the viral content. This viral content undergo transcription and translation. So gagawa yan ng spike, gagawa ng nucleocapsid, gagawa ng envelope. Okay, and they will form in the endoplasmic reticulum. Yan. From the endoplasmic reticulum, it is now ready to release into the Golgi apparatus. Okay, so from the Golgi apparatus, the release of the new infective material for community transmission to infect another individual, okay, who is not observant of the minimum public health standards. Okay, so far, you have questions with this replication.
How long does
Okay,
it
may
take
I
though
know?
to
Yes, you have
replicate?
some question. Come again?
How
Choppy,
long
choppy.
how long does it take to the virus to replicate inside the blank?
Yes, that's a good question. You know, the virus can replicate 3 to 6 hours. So they are fast. They can replicate 3 to 6 hours in just a matter, okay, of 3 to 6 hours. And this patient or person is highly infectious. Okay, so this is how they fast. Okay, kaya mabilis kumalat. Okay, so kaya mabilis kumalat ang SARS-CoV-2. So any question? 3 to 6 hours. Any more? Maliwanag.
Doc, first line treatment ba yung remdesivir to?
Okay, this is a standard treatment. Okay, so based on the WHO, ayaw nilang tanggapin. But the fellow of the American Society of America, Infectious Disease Society of America, recommends the remdesivir because based on the studies of the ACT trial, 1 and 2, the ACT trial, remdesivir can reduce the hospitalization days from 15 days to 11 days. And I have a lot of patients who have been given with remdesivir and dexamethasone, and they have good recovery. Okay? So standard treatment siya, remdesivir. Okay? But I do not, but there are some politicians, okay, who do not, politicians, not physicians, who do not recommend remdesivir. Any more?
Hello, Doc. Doc,
Yes.
yung ivermectin, Doc, are you, ang tawag
Later
dito?
on, we will discuss the ivermectin. But I have to answer this question na it's not recommended. So in our society, the Philippine Society of Microbiology and Infectious Disease, which I am a fellow of the PISMIT, do not still recommend the ivermectin because the ivermectin plus the standard of care, whether you give the ivermectin, there is no significant difference. And what we can still get from ivermectin are the side effects if you do not really know the dose, okay, and lead to neurologic side effects. But we're
Thank you,
still
Doc.
waiting for the studies to come. Okay. So virus or virions are apparently not formed by bonding at the plasma membrane. So you see, the virus is directly, okay, that can undergo exocytosis out from the host cell. They do not bond in the plasma membrane as the previous discussion, like the picornavirus, they bond into the plasma membrane to be for prior to the release. But here we do not. So large number of particles may be seen on the exterior of infected cells and the preparation. So marami, there are multiple viruses that will be released from this host cell. Okay, certain coronaviruses induce cell fusion. This is mediated by the S glycoprotein and requires a pH of 6.5 or higher. So they are more of an alkaline. So some coronaviruses establish a persistent infection on the host cell. Okay, so coronaviruses exhibit a high frequency of mutation during each round of replication. This is what I'm telling you. High recombination. That's why if many are infected with coronaviruses, they undergo replication. And this is an RNA virus. And RNA virus, it is intrinsic to them, inherent to them, to undergo deletion or mutation. That's why there are variants of concern. Coronaviruses undergo high frequency of recombination during replication. Okay, so this is unusual for RNA virus. Okay, with a non-segmented. Remember, non-segmented should not undergo, rarely undergoes replication or mutation. But here, in coronaviruses, which is still a non-segmented, can still has the property, okay, or high frequency of recombination into a new variants of concern. Okay, now let's go to pathogenesis. What happens if you inhale this SARS-CoV-2? So what happens in our body? So we know that the SARS-CoV-2 is via droplet, still not proven to be airborne. Okay, via droplet inhalation. Okay, so once you inhale, it goes into the nose, to the upper respiratory tract. Okay, so this upper respiratory tract is overwhelmed by this SARS-CoV-2. So meaning they are able to evade our innate immune response. Okay, innate immune response, even the cilia, okay, they can invade the ciliated epithelial cells, they can invade the IgA antibody. So once they invade the upper respiratory tract, they can get into the lower respiratory tract. Okay, they get into the lower part of the lungs, the lower part of the respiratory tract. Yeah. Once in the lower part of the respiratory tract, they seize the ACE2 receptor. This is where, okay, on the alveolar cells or the epithelial cells, the ACE2 receptor. So invasion and infection of the type 2 pulmonary alveolar epithelial cells via the ACE2. So the alveolar cells has the ACE2. So they bind to the alveolar cells, particularly the ACE2. Once they bind into the ACE2, it will induce a lot of inflammatory uh, chemicals, okay? Particularly, okay, your interleukin-6. This is your interleukin-6. This is the major culprit causing your cytokine storm. Okay, so there will be inflammatory reaction. Mamamaga. Mamamaga yung ating alveolar cells. Okay, so there will be inflammatory reaction within the alveolar cells, within the interstitial cells. Okay, so after which, okay, another one here. Okay, the viral replication also release viral particles with resultant apoptosis of the host cell. Remember, they replicate in the host cell. Once they replicate in the host cells, they are released. Once they are released, this cell wherein they replicated will undergo apoptosis or programmed cell death. Okay, so this cell will be engulfed by your CD8. Okay, so your CD8 or your cytotoxic T cells will clear off the virus, the viral infected cell. Okay, so it will also undergo programmed cell death. And our immune response will act, okay, particularly your CD4. So your helper T cells during this inflammatory reaction will help, okay, boost the B lymphocytes to produce antibodies. So the helper T cells, that's why it's helper. It will help the B lymphocyte, okay, to produce antibodies. Okay, so that will lessen, okay, the immune reaction. Okay, that's why many will, okay, will recover, okay, because they have a good immune system. Okay, they have enough antibodies to fight against this. Okay, but some, they may not recover. Okay, so continue viral replication and infection. You see, they also destroy, okay, the type 1 pneumocytes, not only the type 2. Remember, your type 2 is very important. Okay, this is the surfactant, right? Okay, it decreases the surface tension, okay, or increases the surface tension. So once this type 1 and type 2 and the inflammatory reaction happens, the patient A die. So the common cause of death among patients with COVID-19 is, we call it acute respiratory distress syndrome. So makikita mo, you can see on the X-ray of this patient, okay, X-ray of this patient is white. Okay, white na. Instead of the lung is black, okay, with the air, it's white now because there is a lot of fluid coming out. Okay, okay, a lot of fluid in the alveolar cells. Okay, a lot of fluid in the alveolar cells. That's why the lung is already white, and that is what we call acute respiratory distress syndrome. And this is a death, okay, causing death. So, any question with your pathogenesis? Am I clear? So this is a good pathophysiologic picture.
Doc Zara, good morning, Doc.
Yes, good morning.
Doc, I'm Neil Suliasta, Doc, from Section F.
Yes.
Doc, we were actually informed before about the potential thrombophlebitis or thrombosis, Doc, or clot formation to patients undergoing the pathophysiology of SARS-CoV-2. What could have caused, Doc, the clot formation?
Okay, that's a good question. Now, the thrombus, this is caused by the leakage. The leakage. So remember the capillary. Okay, the capillary are also involved. Okay, so there will be inflammatory reaction because the capillary will also release a lot of inflammatory cells. Okay, so the prostaglandin causing capillary permeability. This capillary permeability, the platelet exudes out from the capillary, causing thrombus. Okay, thrombus formation. That's why patients with severe or critical pneumonia, they are given low molecular weight heparin. This is a prophylactic drug, okay, prophylactic treatment to decrease thrombus formation, okay, to decrease thrombus formation. That's why we give them enoxaparin. Clear?
Thank you, Doc.
Okay, good. Thank you. Okay, so let's move on. It's at the end of the 2019, a novel coronavirus, the SARS-CoV-2, was identified in Wuhan, China, that caused an epidemic of SARS called the COVID-19. The virus is spread rapidly across continent, with new cases and deaths increasing daily. So on March 11, 2020, COVID-19 was declared pandemic by the World Health Organization. So the strain of coronavirus that caused corona, okay, virus or COVID-19, okay, causing respiratory illness is the one responsible for your COVID-19. So the SARS-CoV-2. So many coronaviruses are known to infect humans. Okay, so the alpha, the beta are known to infect humans, but the beta coronaviruses are the most dangerous among them. So typically, it's respiratory disease of varying disease severity. So it could be mild, could be moderate, could be severe, or could be critical pneumonia. So it varies, okay, the severity. Okay, so going back in 2002, there was your SARS-CoV. Okay, SARS-CoV. Okay, in 2012, there was the Middle East Respiratory Syndrome. Okay, so the host was the camel. Okay, and the camel, and okay, transmitted to human. Okay, transmitted to humans. So, in 2012, and okay, of course, the 2019, your SARS-CoV-2. Okay, so how are they transmitted? Okay, so of course, you know, by this day, okay, that this is transmitted via your droplet. Okay, so once this infected person sneezes or cough out, okay, so this one did not maintain physical distancing, able to inhale, okay, the SARS-CoV-2 from the nose going to the respiratory tract, or this droplet may lodge into your commonly touched object, and you rub your nose or face, okay, then the point of entry of your SARS-CoV-2. Okay, so these are the commonly touched object, the doorknob, your digital devices, your laptop. Okay, so mainly spread from person to person, but it can also be left on an object and surfaces. So what are the signs and symptoms of your COVID-19? Okay, by this time you're still familiar with common, you have the fever and the cough, okay, chills, okay, the body malaise, okay, vomiting, diarrhea, okay, a new loss of taste or smell. So there will be ageusia, anosmia. So every time I wake up in the morning, okay, I make up my coffee. Okay, so inaamoy ko yung aking kape. I see to it that I can still smell, okay, the aroma of the coffee. Okay, so I thank God for giving me this day. And thank God for I still have the sense of smell. Okay, and you have to seek medical care immediately if someone has emergency warning signs of your COVID-19. So trouble breathing, persistent pain or pressure in the chest. Okay, so nakakaroon na siya ng COVID pneumonia, for example, pleuritic pain, okay, or MI could also be an indication of your COVID-19. New confusion, okay, that's why we are allowed, or inability to wake or stay awake. That's why you must have a pulse oximeter. Okay, because once the pulse oximeter, the autosat decreases to 92 or less, you may observe that the patient might be having changes in sensorium because of hypoxia. Or you might know that the patient is having hypoxic encephalopathy. Okay, kaya nagkakaroon na ng bluish lips or face. And we do not want this to happen. Okay, so we have to rush immediately to the hospital. So these are warning signs, okay, that the patient might be, okay, having a moderate to severe, okay, COVID-19 pneumonia. Okay, question? Okay, but this time there are a lot of
I have a question.
symptoms, non-specific signs and symptoms of your COVID-19. Question?
Doc,
Yes.
bakit enough ba yung cup as a warning sign daw para mag-suspect tayo?
Okay. Ano, no? Nagiging medyo magulo yung signal ata.
Enough ba yung cough, Doc, as a warning sign para suspect tayo ng COVID, Doc?
Okay? So if you have a cough, okay, so you have now to isolate. Okay? So that's enough for you to isolate. Okay, and observe for progression of the symptoms. Okay, observe for the progression of these symptoms of your cough in the next 7-10 days. Okay, but you still have a persistent cough, then you subject yourself for RT-PCR. Okay, iba na kasi ngayon. So who is at risk? All of us are at risk of your COVID-19. Poor, rich, children, adolescents, healthy, whether you are a wrestler, okay, you are health buff, okay, strong, okay, all of us are all increase of having this COVID-19 infection. But who are at risk of death or mortality? So patients 65 years of age, living in a nursing home or long-term facility, okay? So with comorbidities like hypertension, uncontrolled BP, 140/90 above, cardiovascular disease, MI, diabetes, uncontrolled sugar, because if your sugar is uncontrolled, there is defect in phagocytosis, so you cannot engulf this virus. Chronic respiratory diseases, because chronic respiratory diseases, they have dysfunctional ciliary, dysfunctional cough defense, okay, COPD, chronic bronchitis, emphysema, asthma, cancer, renal diseases, and obesity. So 10 days ago, I have a patient, 28 years old from San Esteban, who died because one of her risk factor is morbidly obese. Okay, so para siyang Santa Claus na babae.
The
So
question,
this,
Doc,
yes.
what are you going to recommend, Doc? Is it the COVID vaccine or seasonal vaccine, Doc, if you are going to advise?
Of course, if available, your COVID vaccine is very, very important. And then after 14 days, after 14 days from the last second dose of your COVID-19 vaccine, then you can receive the flu vaccine.
Thank you, Doc.
So these are the three phases of your COVID-19 manifestation, progression of the symptoms. So the first stage is what we call your early infection. So once you acquire the virus, during the first 7 days, this is the viremic phase. So you will have fever, okay, cough, body malaise, okay, and when the CDC showed lymphopenia. Okay, lymphopenia. So this is the non-constitutional signs and symptoms. So if this may progress into what we call your pulmonary phase, 2A and 2B. Yung 2A, okay, so the virus has spread now into the lower respiratory tract, and this may cause now your pneumonia. Okay, you have a pneumonia, but it's still mild in 2A. So meaning you can still have a autosat of more than 92%. Your respiratory rate is not more than 24. Okay, you can still tolerate room air without oxygen. But once it progresses into 2B, you see the 2B, okay, you may now have hypoxia. So your respiratory rate could be more than 30, okay, and your autosat is less than 92%, okay? So we now manifest with the shortness of breath, hypoxia on 2B, with a PaFiO2 ratio of less than 300, okay? And when you do a chest x-ray, there is abnormal chest imaging. So typical sa kanila is the peripheral infiltrates. So tabi ng lungs ay may infection, namumuti, and the base of the lungs, peripheral infiltrates. And when you do your CT scan, it may show the GGO. You are familiar with the ground glass opacity. Para siyang pavement. Okay, para siyang mga lakaran na simento na pavement. Okay, the ground glass opacity that may also indicate your COVID-19 infection. And you have a low normal procalcitonin. So meaning your low normal procalcitonin will signify that there is no bacterial infection, that this is per se a viral infection. So and after which, okay, if this is left untreated, okay, grumabe, the patient may undergo what we call the cytokine storm. And this is what we call the high inflammatory phase, hyperinflammatory phase. Okay, so the patient may suffer from ARDS, sepsis, or septic shock. Okay, meron na ditong secondary bacterial infection. When you do your procalcitonin, is already high. So how would you know that the patient is in cytokine storm? You request your inflammatory markers, particularly your serum ferritin. So your serum ferritin is more than 1,000, okay, or above 1,000, okay, mataas yung interleukin 6, LDH, CRP, and this may indicate that the patient is in cytokine storm. Okay, so delikado. Okay, so
Doc,
they may,
question po.
yes.
In routine CBC, Doc, meron siyang septic shock, di ba, Doc? Pero what
Yes.
is the clinical picture of COVID patient, Doc? Is it lymphocytosis or
Now, when the patient now is in shock or in shock, this might have indication that the patient may also have a bacterial infection. Bacterial infection. Remember, in influenza topic, the epithelial cells are ready, are already destroyed, and they can be a niche for your staphylococcus or streptococcus to lodge in. Okay, so there will be here a secondary bacterial infection, especially if you examine the procalcitonin, and the procalcitonin is also elevated, okay, more than 2, okay, it indicates that there is a secondary bacterial infection. Okay.
thank you.
Okay. So pre-symptomatic. During the pre-symptomatic, 2 days before the onset of symptoms, this patient is highly infectious, 47%. Okay, kasi di ba mas mahirap if you do not have symptoms, pre-symptomatic before the onset of symptoms, you are infectious 47%. Okay? So if you are symptomatic, you are infectious at 38% because you know that you have the symptoms, then you have to isolate, do quarantine na. Okay, and if you touch commonly contaminated object, usually 10%, okay, transmission of the virus. Okay, and asymptomatic, okay, you have still 6%. Okay, so if you have the SARS-CoV-2, okay, you have the symptoms of cough, fever, chills, okay, mild difficulty of breathing, then it is mandated that you have to isolate or quarantine for at least 14 days. Okay, for at least 14 days. Okay. So 7 days after the symptom onset, there's still little chance that infection will be transmitted, especially if you remain asymptomatic na. Okay, remain asymptomatic. The 7 days after the symptom onset, you remain asymptomatic, then or 10 days, okay, from asymptomatic stage, you may no longer be infectious or less infectious, but you still have to complete the 40 days. Okay, so what is reproduction number? Okay, so I think you have heard R naught, this one, reproduction number. So the reproduction number, every one of us is susceptible. Okay, no one is safe. So R naught is referring to population where do not have the immunity to the virus. Okay, so if the R naught is equal to 1, okay, this individual infected can transmit this to one infected person. And this infected person can transmit this one infected person. So if you maintain the R naught or reproduction number to 1, okay, hindi dadami yung case. Okay, stable yan. Okay, so walang magiging wave. Okay, stable. But if your R naught is 3, for example, 3, this individual infected 3 person. Remember, R naught is 3, and this one infect 3, 1, 3, 1, 3. So there is 9 infected. So this 3 infect 9, and this 9 infects the 27 people. Okay, so if the R naught is 3, there will be exponential growth. Okay, so madaling kakalat at madaling kumalat. You are giving chance for the virus to replicate. Okay, and undergo mutation. Okay, so our goal is to make the R naught to less than 1. So if less than 1, eventually, okay, wala nang dadapuan yung virus. Pag wala nang dinapuan yung virus, eventually, mawawala yung virus. Then, no one will get infected. If the R naught is more than 1, there will be an exponential growth. If it's equal to 1, it's stable. Okay? So, yan yung R naught. So your R naught, how would you decrease R naught? Of course, to decrease the R naught, you have to adhere to the minimum public health standards. Hand washing, face mask, of course, self-quarantine if you have the signs and symptoms, okay, and of course, distance of at least 2 feet. So this is the RNAT. Way back in August 19, the RNAT was 1.31. Okay, and the latter part of the 2020, the RNAT increases to 1.9. Okay, so for example, if this infected person, gets into, okay, this infected person gets into a crowded place and infect 5. In a matter of 10 days, okay, he has infected 5. The symptom interval, for example, is 10 days. The RNAT is 5. This individual infected 5 person. After 10 days, okay, 10 days, symptom interval. After 10 days, it infected 1. Each one infected 5. So in 20 days, okay, 5, 10, 15, 25 were infected. After 10 days, these 5 infected 25. Okay, so all of them infected 125. So in just a matter of 30 days, it infected 125 individuals. And these 125 individuals will infect another, okay, individuals. Okay, if the symptom interval is just 10 days. Okay, paano kung 5 lang ang symptom interval? In just 5 days, you were infected. 5 days, 5 days. Ang dami. Okay? So what is important if the symptom interval is 30 days? Matagal. Okay, in 30 days, you infected only 6. Okay, and this 6, okay, undergoes isolation or quarantine isolation. Okay, and this virus can no longer lodge into another individual and eventually it will die. So we want that the symptom interval to be more than 30 days or more than 30 days para wala nang dapuan yung SARS-CoV-2. Okay, so if your RNAT is less than 0, okay, more or less 0, and your symptom interval is high, then infection will decrease. Okay, if your RNAT is more than 0 or 1, okay, and your symptom interval is less, okay, for example, 10 days or 5 days, mas marami kang mahahawaan. Okay, so the goal is to decrease the RNAT and to increase the symptom interval. Okay, now let's move on to your signs and symptoms. Okay, this is the table, okay, based on the WHO guidance May 2020, and this is still followed. Your COVID-19 still followed by your field health. Okay, you can diagnose mild pneumonia, moderate pneumonia, severe pneumonia, or critical pneumonia. So your mild is just constitutional signs and symptoms. You don't need oxygen. Okay, so isolate lang sa bahay. If it is moderate, okay, moderate pneumonia, you still have an autosat of more than 92, okay, RR is 21 to 30, okay, you request this laboratory test. Okay, so moderate, especially those with risk factors like diabetes, hypertension, you have to admit them. Okay, and if it's severe, less than 92 autosat, more than 30 RR, request for this laboratory, okay, and you have to admit the patient in the hospital. And if it's critical, okay, so it's life, okay, so it's critical, okay, you have to request, okay, for your inflammatory markers like ferritin, LDH, procalcitonin to determine if the patient is on cytokine storm, and you have to admit them in the intensive care unit. Okay, so this is the stages of your pneumonia: mild, moderate, severe, and critical pneumonia. Pag mild, 43,000 of PhilHealth. Pag moderate, I think 143. Okay, pag severe, 700 ata. Ito, yung PhilHealth coverage. Okay, so after infection, what happened? Okay, what happened? Okay, so there will be immunity. Okay, there will be immunity. Okay, so immunity develops, but it's not absolute. So meaning, our antibodies against the SARS-CoV-2 wanes off. If you have mild symptoms, your antibody may wane off in 3 months. Severe or critical, it may wane off 6 to 9 months. So that's why you are still susceptible of having infection with the same strain. Okay, with the same strain. That's why the vaccine is under study that after this month, there will be booster doses of your vaccine to cover also the variants of concern. So still waiting for the study. Okay, so kung kailan o hanggang kailan o what time is the booster to be given. for your COVID-19 vaccine. So any question? Signs and symptoms: mild, moderate, critical, severe, maliwanag yun, ha? Okay. So how do we test for COVID-19? Okay. So of course, you test for COVID-19 or PCR, antigen testing, and antibody. So PCR will be the gold standard test for your COVID-19. So ito yung kina-cover ng PhilHealth. Kailangan may result ka, okay, before you be covered by your PhilHealth to be confirmed. Okay. So there is also probable COVID-19. So meaning, even if your test is negative, your PCR is negative, but you manifest typical symptoms of your COVID-19, you have exposure to COVID-19, then you can be diagnosed with probable COVID-19. Okay, so PCR is most accurate, okay, longer processing time. Antigen is rapid and inexpensive, but accuracy problem. Okay, so your antigen testing should be done to those people who are symptomatic. Antigen, dapat 5 days or to 7 days after the symptom, then you do your antigen. Antibody, okay, this is rapid, but it has a high false positive and a high false negative. So this is the PCR. Okay, you are familiar with. I think one of you has undergone PCR test. This is your antigen testing, and this is your antibody test. So the PCR is the most accurate. Costs more, 3,500 to 5,000. Requires sophisticated lab equipment. So biosafety level 3, skilled and trained staff. You take more time to get results, involve swabbing and WHO recommendations. Okay, so this is the pharmacologic treatment for your COVID-19. So if you are not hospitalized, you have mild to moderate COVID-19. Okay, there are insufficient data to recommend either or against the use of specific antibodies. You do not give yung mga bamlanivimab, casirivimab, leronlimab. Okay, it's not indicated. Okay, so not hospitalized, mild to moderate. Okay, hindi ka naman nagdidisat. The panel recommends against the use of dexamethasone. Okay, if you are hospitalized but you do not need oxygen, okay, against the use of dexamethasone. If you are hospitalized and you need oxygen, okay, you can be given remdesivir, okay, and you can be given dexamethasone. Okay, so if you need oxygen, okay, one of the following options, remdesivir, and you have the dexamethasone. Okay, if you are hospitalized and you need a high flow, okay, device, okay, it is the standard of care that you must be given dexamethasone or dexamethasone plus remdesivir. Remember, your remdesivir will inhibit the polymerase enzyme. If you are hospitalized using mechanical ventilation, tutubo ka na, okay, it is mandatory that you must be given dexamethasone. Because dexamethasone, based on the recovery study, it decreases mortality. Okay, decreases mortality. Okay, so this is your reading assignment. Please read these captions. Very, very important. So I will hold you responsible for this. Okay, this is me. I have a patient who has to be given with, this is the remdesivir. Okay, remdesivir. Okay, before those days, this is cost around 7,000 in Manila. Okay, it costs around 18,000, 10,000 to 18,000. This is tocilizumab. This tocilizumab is the one that inhibits the interleukin-6. It will inhibit the cytokine storm. Tocilizumab, this costs around, I think, 50,000 per bottle or 40 to 50,000 per bottle. If you are in medical matataas na hospital, this may cost around 70,000. Okay, so this is the tocilizumab. Okay, this is the dexamethasone. It is given 6 milligram IV once a day for 10 days. Okay, question kanina, this is the enoxaparin, your low molecular weight heparin, to prevent the formation of thrombus, para hindi mag-pulmonary embolism yung patient. Okay? So any question with your treatment?
Doc,
Okay.
Doc, I would like to ask po about what if, is there a second line therapy, for example, in the event that remdesivir will not be available, for example, will there be an alternative drug, for example, Doc, to give or recommended second line therapy in lieu remdesivir will not be available in the facility.
If remdesivir is not available, you can give your favipiravir, your Avigan, but that is a tablet, okay, doublet, okay? So it's not available, favipiravir, okay, or the Avigan. All of these are under your compassionate use, okay, your emergency use authorization. Okay, so this is how you prevent. This is the important one. Even if you have the COVID-19 vaccine, you still have to adhere to the minimum public health standards. Okay, so these are the vaccines. Okay, so you have the several platforms of your vaccine. You have the RNA, you have the Pfizer and Moderna. So dumating na yung Pfizer sa Pilipinas. Problem lang dito talaga yung storage. Okay, so these are good. And your Pfizer can be given now to 12 to 15 years old. Okay, so it's safe na. Okay, so good protection. So you have the viral vector, you have the Oxford AstraZeneca. Okay, so in here in the Philippines, we have not yet proven that there are clot formation. Okay, so it's still safe. Okay, so CanSino Biologics, the Gamaleya from Russia, and the J&J, 2 doses there. Okay, we have the whole virus, the Sinovac, which I have received. Okay, so Bharat from India. Okay, so we pray for our kababayan, our friends from India that they may be safe. Okay, the Sinopharm inactivated, the one injected to President Duterte, but this is still has not passed yet the emergency use authorization. Okay, and the protein subunit, we have the Novavax. I have still to answer this COVID patient, COVID nurse. Hello? Okay, nawala. Okay, so these are, okay, so whatever is available, COVID-19 vaccine, that is the best. Okay, so ano man yung napunta sa yung balikat, ay sa deltoid mo, that's still the best vaccine. Sorry. Hello? Yes. Ay, thank you. Okay. Okay lang. COPD. Pumangit. Nag-remdesivir ka na? Sige nga, i-load mo na ng remdesivir. Load. Tapos dexamethasone at saka enoxaparin na. Okay, pangit siya. Oo. Pumangit yung x-ray niya. Oh, pero nag-remdesivir na sila. Okay. Okay, start na natin. Oo. Okay. Thank you. Titignan natin. Ma'am, bukas. Okay. Thank you. So still, I have 2 patients na toxic. Okay, so I have to give remdesivir and dexamethasone and enoxaparin. Okay, so may refer na dalawang pasyente. Okay, so this is the COVID-19 vaccine. So COVID-19 vaccine provide excellent protection against the virus that causes COVID, preventing up to 95% infection. So the vaccine protects you and people around you too. Okay, so even with the COVID-19 vaccine, we need to continue practicing all the recommended public health standards. Okay, so a question. So let's move on to your rabies. Okay, so maiba naman. So rabies is an acute infection of the central nervous system that is almost always fatal. So it's usually transmitted to humans from the bite of a rabid animal. So although the number of human cases is small, rabies is a major public health problem because it's a widespread among animal reservoir. You know, every 9 minutes, there is immortality from rabies. Kada 9 minutes, 1 mortality in the entire world of rabies. So this is the structure of the rabies. So it's a bullet shape. Okay, so it's around 170 to 180. and the diameter is usually 80 nanometer. So it is an RNA virus. Okay, so this is a single-stranded, linear, non-segmented, negative sense. Unlike your corona, it's positive sense. This is a negative sense, okay, RNA. So there are 5 major proteins. 1, 2, 3, 4, 5. Okay, 5 major proteins. Okay, and this is usually an envelope. Okay, envelope RNA virus. So the replication also happens in the cytoplasm. So there is a wide array of broad host range. Okay, group includes deadly virus, rabies. Yes.
Doc, nakamute po.
Okay, so napindot ko yung mute. So the virus are classified in the family Rhabdoviridae. Okay, so belong to the genus Lysa virus. So it's the only medically important is the rhabdovirus. Okay, so the virus usually survives at the 4 degrees centigrade for weeks to negative 70 for years. So it is inactivated by CO2, dry ice, and glass shield. That's why your rabies vaccine should be protected from light. So rabies is killed rapidly by exposure to UV radiation or sunlight, by lipid solvent or trypsin, okay, and by extremes of pH. Okay, so this is how simple they replicate. Okay, you see this rabies virus, the glycoprotein binds to the receptor, okay, the phosphatidylserine receptor. After binding, it undergoes endocytosis. Okay, endocytosis. So it penetrates, then it releases the RNA virus. So it uncoats. Okay, so it uncoats your negative. Okay, uncoating. The viral negative sense RNA is transcribed. Okay, it's transcribed into your positive sense RNA. Yeah, positive sense RNA. Then the positive sense RNA will serve as a template for the synthesis of your viral genome plus RNA that gives rise to your viral protein. Yeah. This positive sense, okay, so the negative sense RNA becomes incorporated, okay, incorporated into your nucleocapsid, okay, and attached to your M protein, and they will bud to the plasma membrane and ready to be released. So nagbabad sila sa plasma membrane, unlike your corona, it does not bud. Okay, so this is the summary of your virus replication of the virus. So you have wide host variety range. It varies from a high to low. Okay, foxes high, coyotes, jacks, cotton. Moderate is here the dogs, sheep, goats, horses. Okay, hamster high, cats, bikes, rabbits. Yeah. So it's widely distributed in infected animals, especially in the nervous system, saliva, urine, nose, and blood. So it's highly fatal. So it's 99%. If you have rabbit, it's 99% fatality. So there is a single serotype of rabies virus. However, there are strains different among viruses isolated from different species. So the virus strains can be distinguished by epitopes, the antigen, okay, so monoclonal antibodies as well as specific nucleotide sequences. So there are at least 7 antigenic variants found in the terrestrial animals and bats. So the G protein is a major factor kasi siya yung dumidikit in the neuroinvasiveness and pathogenesis. This is the pathogenesis. If you are bitten by the dog, this is a rabid dog. Ginalit mo siya, provoke. Okay, you provoke this dog, you were bitten, and the virus gets into the muscles. In the muscles, the virus replicates. Okay, the nicotine acetylcholine receptor. Okay, it binds to the nicotinic acetylcholine receptor. Okay, at the neuromuscular junction. Here, the virus attaches here. Okay, and it then transported by a retrograde axonal transport. Okay, 2 to 4 millimeters per day. It will travel. Okay, to the axon, from the axon. Okay, to the cell body, from the cell body, it goes into the spinal cord. It replicates in the motor and sensory, okay, ganglia. Okay, from the spinal cord, it goes into the brain. Okay, it infects the neuronal. Okay, from the neurons, okay, it goes into the salivary gland. So centrifugal spread along the salivary gland. Okay, from the salivary gland, it goes into the saliva. So this infected person, okay, should be isolated because baka duraan ka niya at yung dura mapunta sa mata mo, okay, o mapunta sa nose, okay, and you become rabid as well. Okay, so you have to isolate this. So this is highly infectious person. Okay, the organ with the highest titer of virus in the submaxillary salivary gland. Yan. So who are susceptible? Okay, so those are elderly, genetic host range, genetic background, okay, the viral strains involved, okay, malaki ang sugat mo, kagat mo, high inoculum virus, severity of the laceration, you were beaten, category 3, talagang malaki yung lacerations mo, and the distance. Okay, if you were beaten, okay, sa face, sa neck, that's category 3. So mabilis siyang pumalat papunta sa brain ka. Kasi dito, unlike sa paa, it has to travel papunta sa spinal cord. But here in the face, directly, it might go into the brain. Okay, so it's higher attack rate and mortality is high. So how do we test? If you were bitten by the dog, subject the dog for histopath. Okay, so this is the Negri bodies in the brain tissue. So these are the Negri bodies. So there is our eosinophilic inclusion, sharply outlined, which is pathognomonic of your rabies, the Negri bodies. Ang mahirap dito pag kinagat, pinapatay yung aso kinakain. No. Okay, he might get rabies also from eating these contaminated rabbit dogs. Okay, so we have 3 clinical findings. The incubation period varies from 1 to 3 months, but may be short as 1 week or more than a year. Yung iba nga 5 years, yung iba 7 years. Kaya pag nakagad ka, even though na may bakuna yung aso, to decrease your anxiety, you subject yourself also from vaccination. And you have to observe the dog for at least 10 days. So there are 3 stages. You have the short prodromal phase, the neurologic phase, and eventually coma and death. So your short prodromal phase, these are non-constitutional symptoms, vomiting, headache, photophobia. Then you have the acute neurologic phase. Ito yung mabantayan mo rin. So patient may have apprehension, hallucination, bizarre behavior. Okay, and general sympathetic overactivity. Okay, you have increased salivation and perspiration. Okay, and this neurologic, okay, this is also the sign where the patient is fearing water, hydrophobia. Okay, so the act of swallowing precipitate painful spasm of the throat muscles and aerophobia. When you try to paypayan mo sila, okay, they will have a violent behavior. Okay, so the phase is followed by convulsive seizure and eventually lead to coma, and the most common cause of death is cardiorespiratory arrest. So paralytic rabies occurs 30% of patients. Okay, so laboratory tests. Okay, so in here in the Philippines, okay, so we subject the brain of the dog for Negri bodies. Okay, but here is usually clinical. Okay, so but then you can also examine the saliva. Okay, lumbar puncture, CSF. Kaya nakakatakot. Lumbar puncture mo yung rabbit patients. Okay, blood tests. Okay, examination like PCR. Okay, fluorescent antibody for rabies virus. Okay, and histologic. Ito yung pinaka-okay pa. Pathognomonic sign, the Negri bodies. So, rabies post-exposure prophylaxis, yan, dogs, cats, domestic, wild, okay, and others. So, this one, about 9 minutes per, 1 death every 9 minutes. See? Okay? So, you have to vaccinate the dog. So, vaccinating the dog, 70% of the dogs breaks the transmission of your rabies, okay, cycle in that area. So, every dog owner is concerned. Be a responsible owner. So, because 97% of human cases are caused by dog bites. So, this is highly, very, very fatal. Okay? So, your, pag nakagat, of course, thorough washing of the wound with soap and vaccine. Okay? So, pathophysiology, I have discussed already. Okay? And you have the types of vaccine. So, if you are bitten, category 3, okay, malaki yung area ng bite, you should be given passive antibodies. Then, you have to receive active antibodies. The human diploid cell vaccine and the purified chick embryo cell vaccine. So, day 0, day 3, day 7, day 28. Halimbawa, kinagat ka January 1, pabakuna ka day 0. After 3 days, second dose. After 7 days, third dose. And the fourth dose is 28. Pero during the observation, okay, you have to observe the dog for at least 10 days. If the dog is still healthy, okay, that is not rabid, mahalata mo pag rabid yung dog kasi mauulol yung aso. Okay? So on the 28th day, your dog still remains healthy, no rabies at all. okay, healthy, okay, does not isolate, okay, the dog does not isolate, then you can defer the fourth dose. Okay? So, parang 0, 3, 7, pwede na. Okay? So, if you have vaccine before and you were bitten by the dog, prophylaxis na lang. Day 0 and day 3 na lang. Day 0 and day 3. If you have previous vaccine. Okay? Any question? So, that ends our rabies.
Doc,
Question?
Doc, question po regarding sa COVID pa rin.
Yes. Yes,
Ah,
okay.
But before that, Doc, a happy birthday po.
Thank you. In fact, kanina nalimutan ko yung klase ko sa HIV, sa 3rd G. Na-toxic kasi ako. So tumawag yung mayor na, Doc, may klase po tayo na 8 o'clock. Ay, Diyos ko ba, ganun po ba? Kaya pala 9:30. Kaya kasabi ko kay Jeremiah kanina, Jeremiah, mag-start tayo ng 8. So I was wondering, bakit 9:30 yung klase ko? Yung pala, may klase ako ng 8 to 9:30, HIV AIDS. I was in the hospital. Kaya nilipat ko ng 11 o'clock. Thank you. Salamat. Okay, question pa.
May statement kasi si Dr. Tony Liachon po, kung kilala niyo po siya.
Yes, our previous president from the Philippine College of Physics.
Sabi niya kasi sa latest na statement niya, we are still at 40 to 60,000 vaccination per day. At this rate, we can never finish the AstraZeneca 1.5 million stocks that will expire in June. Local government units is still loaded with Sinovac stocks. We have not yet finished the 3 million doses of Sinovac. So yung question ko po, Doc, what is your say with regards to this information and can you confirm this po? And another one po is maybe we get some information and updates regarding the vaccination here in Ilocos po. Thank you.
Okay. Doon sa kay statement ni si Dr. Lechon, oo, mahirap yung vaccination status kasi I think we can still achieve the herd immunity in 2022 or 2023. Okay, because of the delay in the delivery of the delivery of vaccine. So it's hard to achieve the herd immunity because mahirap kumuha ng vaccine. Okay, so maraming nag-hold ng vaccine, especially in the first world country. So it's difficult to achieve the herd immunity. Okay, so mahirap. So kung target natin is yung sinasabi ni Mace, it's difficult because kaya nga delay pa nga pagdating ng Pfizer and also the Sinovac. Okay? So the only 3 vaccines pa, AstraZeneca, the Sinovac, and the Pfizer that has finished their submission ng papers regarding the emergency use authorization. Here in the Locos, we have some vaccinated senior citizens, but we have not fully vaccinated all the senior citizens and the indigents. So mabagal kasi they prioritize the Metro Manila, vaccinating the Metro Manila. Okay, dito sa Ilocos. Konti pa lang talaga.
Pero dito po sa Ilocos, Doc, meron po ba tayong ano ba yun, stores po or ano ba yun? Parang
Storage?
opo, may mga available vaccines pa po ba dito sa atin?
Right now, the available vaccine is the AstraZeneca, and they have to give this to those who have given the first dose vaccine, yung AstraZeneca. Okay, so they have to give before May 31 the second dose of those who were given the first dose of AstraZeneca, especially among senior citizens, 60 and above.
Doc, possible po ba na if ever na gusto na sana naming magpa-vaccine, pwede po bang, ibigay na lang nila? Kasi, parang madami naman palang stores or, na available po.
I think the local government unit can answer this. Local government unit from where you live, is getting census. They have gotten the census regarding students who have to be vaccinated na. Census. So you have to approach your local government or your MHO, municipal health officer. Okay po. Okay. So
Hi, Doc.
yes.
Doc, the virus po is always changing po. As an infectious disease specialist po, Doc, para po sa inyo, how soon will this pandemic end, Doc? Thank you, Doc.
I think this pandemic will not end soon. Okay? So even though we have the COVID-19 vaccine, Okay, remember your COVID-19 vaccine is still not 100%. Okay, you may still experience mild pneumonia and moderate pneumonia. So this, I don't know where will it end, 5 years or 10 years. We do not know yet. I cannot tell.
Hello, Doc. Question po.
Yes.
Doc, regarding sa variant ng virus, Doc, is race a factor for the
Variant.
variant of the COVID?
Ah,
COVID. Is
oo.
race a factor, Doc, for the variant?
Race is not a factor. Okay, so it happened only in South Africa because of also the many cases. It happened in UK because of the many cases, and it also happened in the Philippines, the P3 variant, because of the many cases. The factor usually is the cases. The cases. Remember in India, okay, there is already the variant of India. And there was one infectious doctor who got infected, who died, even though he had received the 2 doses of Pfizer vaccine. Okay, the Indian variant is very, very fatal.
Okay, Doc. Thank you po, Doc.
Okay?
Doc,
Yes.
Doc, with regards po sa question ni Dr. Wagayan about the variant of SARS-CoV-2, Doc, is it really safe to say, Doc, that yung current strain of SARS-CoV-2 might have mutated from the first strain of SARS-CoV that led to a 2003 SARS pandemic? Doc, parang nag-mutate lang yung first na coronavirus? Or
Ay,
is
no,
it
no,
a
no.
different strain?
Different. It's a different strain. Your 2003 okay, SARS-CoV is
Yes, Doc.
different from your 2019, 2019. So it's totally different because the genomic sequence of the SARS-CoV is totally different from the genomic sequence. Yung genomic sequence ng SARS-CoV-2 was sequenced by the Chinese doctor, and it found out that it's different from the 2012, your Middle East in 2003.
Okay, Doc. And then, Doc, follow-up question, Doc, with regards to the question of Dr. Serna about the unpredictability of COVID, the termination of the pandemic. So next year, Doc, there is a lesser chance for us to undergo clerkship in ITRMC, for example.
I think there will be better chances, siguro. Better chances na magkaroon na ng clerkship, pero there's still limitation of the rotation. Baka mamaya rotate lang ng ganito, baka ganun lang. So, baka major rotations lang, tapos pailan-ilan lang yung clerk na mag-rotate. Probably ganun for the safety. If yung aking knowledge. Okay. So, thank you.
Thank you po, Doc.
Thank you. So, keep safe all. Salamat. I hope you learned something. Okay, thank you.
Bye,
Okay.
Doc. Ingat ka po.
Happy birthday, Doc.
Salamat, salamat.
Happy birthday, Doc.
Okay, Doc. Happy birthday.
Happy birthday, Doc.
Doc,
Birthday mo, Doc.
Doc,
Thank you po. Birthday po,
pwede po
Doc.
mag-attendance?
Yeah, attendance, please. Please.
On po videos. Smile lang po.
Happy birthday, Doc.
Thank you. Okay, na yung attendance.
Thank you, Doc. Happy birthday po.
Thank
Okay
you.
na, Doc.
Thank you.
Happy birthday po.
Ingat po.
Happy birthday po, Doc.